The Australian healthcare system aims to provide universal healthcare to all Australians. The system is a mixture of a welfare state model and a privatised market. It comprises of public and private services, providers, and organisational bodies. One key strength of the Australian healthcare system is that all citizens are covered by Medicare, a free and compulsory public health insurance scheme funded through taxation. There are three components of Medicare. Hospital care. Medicare provides free access to treatment in public hospitals. Medical care. Medicare subsidises some primary health services, such as consultations with general practitioners. Pharmaceutical benefits. The cost of many prescription medications are subsidised through the Pharmaceutical Benefits Scheme. In addition to Medicare, approximately half of all Australians have private health insurance. Private health insurance covers access to private treatment in either a public or private hospital, some ancillary services, and some non-admitted procedures. The main benefits of private health insurance are shorter waiting times for surgery and the ability to choose a doctor.
Primary healthcare includes providers and services across the public, private, and non-government sectors. At a clinical level, primary healthcare refers to the first point of contact an individual, family, or community has with a healthcare professional, with an effective system being socially appropriate, universally accessible, and scientifically sound first-level care. Two examples of primary healthcare points of contact are GPs and dental professionals. A significant strength of primary healthcare within Australia is the high rate of individuals accessing services. In 2013, 83% of Australians reported consulting with a GP at least once that year. A noteworthy challenge of primary healthcare within Australia is the disparity of access and outcomes for people in various population groups, such as those living in areas of lower socioeconomic status, people living in rural areas, and Aboriginal or Torres Strait Islander Australians.
One of the biggest problems for Australia is providing equal opportunities to access healthcare services in rural and remote Australia. Increased distance from urban areas means an increased disadvantage in health. The healthcare system has developed 24/7 telephone assistance and fly in and out practitioner services for people experiencing health problems and general checkups. Mental health services are available via telephone and internet access 24/7. Environmental factors such as accessibility of healthcare services and social factors such as cultural beliefs also affect equity of healthcare services for rural and remote people. Healthcare services are worsened by the Australian government's umbrella policies for health. These policies do not always consider the complex needs of rural and remote communities. Without using a grassroots approach, these policies have created a larger health status difference for rural and remote communities.
Public hospitals are government funded, with one key strength being that they provide free healthcare and emergency care to all Australian citizens. Access to public hospitals is based on medical need, with services required within an appropriate time period. There is an aim to provide equity and access to all public hospital services, despite one's location in Australia. Originally, public hospitals provided acute care. However, a continuum of care has developed, including subacute care. Although hospitals in general are organised formally with rigorous codes of conduct and hierarchies amongst health professions, there is still an attempt to promote professional autonomy so they can exercise judgment as they see fit and develop further within their field. A current challenge faced by the Australian healthcare system is limited funding provided by the federal government, resulting in decreased opportunities for education, training and research.
All the components of the healthcare system discussed so far have been developed through the understanding of the Western medical system and have largely been shaped by the development of antibiotics and immunisations since World War II. But it's still important to remember that prior to this, and still in many other cultures, there are many alternative systems and approaches to enabling health and preventing illness. These diverse healthcare practices exist parallel with, but not part of, the mainstream biomedical model and are known as complementary and alternative medicine. One strength of the Australian healthcare system is that complementary and alternative medicine, such as osteopathic and chiropractic medicine, are now eligible for government-funded Medicare rebates. While some that are excluded from Medicare rebates are covered by private health insurance schemes, still more aren't covered by either, and consumers incur high out-of-pocket costs. With over 50% of Australians accessing complementary medical practices, often in conjunction with Western medicine, there is a need to better integrate complementary and alternative medicine practices into the healthcare system to ensure better regulation and more equitable access for all Australians. The Australian healthcare system is made up of many complex components, so ensuring efficiency and equity of access are constant challenges for our government. We're lucky to have one of the best healthcare systems in the world. Nevertheless, there are significant areas for improvement if we are to truly achieve universal healthcare.